Hello, everyone. Good morning and good afternoon and good evening. We'll get started now with our webinar. Thanks so much, everyone, for joining today. My name is Sweta Shah with the Aga Khan Foundation, and I lead the early childhood development work for the foundation. I'm really pleased and excited for this webinar, and thanks to all of you for joining today. This issue of looking at children with disabilities and developmental delays has come up multiple times in our community through other webinars, and it's come up through questions. And we just felt that insufficient focus has been placed on this very vulnerable group. And so we thought it would make sense to have a global webinar today where we could talk about not only what does it mean how do you define children with disabilities and developmental delays? What are some practical ways that practitioners can support them? And what is some of the new research that's coming out on how to help them? We'll be addressing all of that today in this webinar. First, I'd like to welcome Ms. So-hee Won from the LEGO Foundation to say a welcome and to say a few words to all of us.
Thank you, Sweta. Good morning, good afternoon, and good evening. I am delighted to be here today and welcome you all to this meaningful webinar on nurturing care for children with developmental delays and disabilities. It is such a pleasure to open these important discussions about how children with developmental delays and difficulties can have the best chance to not only survive, but also thrive, based on emerging research and practical examples from several countries across the globe. We know that children's earliest years represent a critical phase of development, and holistic development of children can only be achieved when they receive quality nurturing care, keeping them safe, healthy, and well-nourished, paying attention and responding to their needs and interests, encouraging them to explore their environment and interact with others, and providing responsive stimulation, including playful parent-child interactions. And it should be emphasized that children with developmental delays, difficulties, and disabilities need quality nurturing care just as much as any other child, or even more. They should not be left behind. We all have a shared responsibility to provide an optimal environment for our children that promotes their physical, emotional, social, and cognitive development. And that's why the webinars like this, where we can share lessons learned in addressing the challenges and the needs of children with the developmental delays and difficulties are so important. Another point that I would like to highlight is that parents and caregivers play a significant role in supporting the development of their children. Growing evidence from parenting interventions had shown that increased quality interactions and nurturing care between primary caregivers and their children during the early years leads to improved learning and health outcomes that persistent throughout the life course. And over the last few months, we have seen how the global pandemic highlighted the fundamental role that parents and caregivers play in the development of their children. Therefore, it is very critical to help them become the best providers for nurturing care for their children. And this support is especially important for the parents and caregivers who have children with developmental delays and disabilities. As a committed champion of all children, the LEGO Foundation believes that when parents have interactions and provide the nurturing care that are meaningful and actively engaging, and when they help their children iterate and interact with others, and when they bring joy to the bond they have with their children, they help their children to develop their full potential. At the LEGO Foundation, we simply call this rich and warm interaction and quality care playful parenting. And that is where the LEGO Foundation has embarked on multi-year partnership with UNICEF, ECDAN, and Aga Khan Foundation to promote playful parenting and nurturing care for all children, including children with developmental delays and disabilities. More than ever before, we needed to redouble our energies to make sure that we provide families with the support that they need so all children can fulfill their potential equally and with dignity. This requires collaborations among different actors, such as governments, private sectors, academia, and civil society across all sectors. On behalf of the LEGO Foundation, I want to express our gratitude to UNICEF, ECDAN, and Aga Khan Foundation, who have brought our attention to this important topic. The LEGO Foundation will stand next to you and work to give every child a good start and necessary support in life. I wish you productive discussions today. Thank you.
Thank you so much, Sohee. We're going to start our webinar today with a framing of this topic. And I'm going to ask two of our colleagues, Asma Maladwala from UNICEF and also Bernadette Dalemans from WHO. So let's start with you, Asma.
Thank you, Sweta. Just getting my, there we go. So thanks, I'm really excited to be here today, and I'm so pleased that we're having this conversation, and I'm really looking forward to our ongoing discussions and Q&A and opportunities to continue to further this, the agenda of disability inclusive programming in the early years. So just to start with, I would like to share just a brief overview of who we mean when we talk about children with developmental delays and disabilities, and what we think about when we say disability inclusive programming. So we know that the early years, the period of early childhood, is crucial to support optimal development and growth for all children. For children with developmental delays and disabilities, early identification and provision of appropriate early interventions and supports during this period can be life-altering and even life-saving. Developmental delays can be addressed, and the long-term impact of disability can be mitigated. Well, we're so super excited to hear about some really great programs, inclusive programs today. Unfortunately, these are still very much the exception, and children with disabilities continue to be largely overlooked in mainstream service provision. They also seldom receive the disability-specific services that they require, placing them at greater risk of compromised outcomes and quality of life. There are many reasons for their exclusion, including barriers such as stigma and negative attitudes, lack of consideration and policies, unavailability of the appropriate, inclusive, and accessible services that they need, and inaccessible physical and informational environments, just to name a few. Invisibility in data means invisibility in planning, budgeting, and programming. We need more reliable and robust data, but we do know from a recent 2016 study that indicated that globally almost 53 million children, or about 8.5% of children under the age of 5, had developmental delays, and about 95% of these children live in low and middle income countries. The UN Convention on the Rights of the Child and the UN Convention on the Rights of Persons with Disabilities affirm the equal rights of children with disabilities across all aspects of life, including health, education, nutrition, and social protection. And the Convention on the Rights of Persons with Disabilities further affirms their right to specific services such as early intervention and rehabilitation. Children with disabilities are a heterogeneous group, and each individual will experience disability differently based on multiple factors such as health conditions, functional impairments, environmental and personal factors. And services and supports need to be responsive to this diversity. Taking a twin track approach to the development of policy and programs ensures children with disabilities are reached through mainstream services, as well as targeted disability-specific services, such as early intervention and the provision of assistive devices. Both streams have to occur in parallel in order for children with disabilities to truly be included and fulfill their rights. And on the screen, I've shared just a couple of definitions to sort of clarify. We had a few questions about how do we define, what do we mean when we talk about children with disabilities and developmental delays, and a very rudimentary illustration of what taking the twin track approach to programming would look like, with a few examples. And I'm looking forward to continuing this conversation during our discussion and Q&A. So thank you for that. And with that, I'm going to hand over to my colleague, Bernadette.
Thank you very much, Asma, for these remarks, and greetings to everyone in the world. Good morning, good afternoon, and good evening. So I will add a few observations to what the two speakers before me have said, and I would like to reflect upon how the Nurturing Care framework can contribute to the agenda that we are laying out today. So first 3 points as a brief reminder of what the Nurturing Care framework represents. Nurturing care as care that all children need, composed of health, nutrition, security, safety, responsive caregiving, early learning. And then the second principle of the enabling environments that are needed in order for children to receive that care. Within that, families, parents, proximal family members and other caregivers are recognized as the persons who create that enabling environment. But for them, in order to provide nurturing care, we need policies, services, communities that are able to support that family. A third dimension of the nurturing care framework comes with the progressive universal approach. And so the nurturing care framework is truly integrative and inclusive of all children, and therefore it promotes that everyone, all families and children need some support, but as additional risks occur and needs are there, services need to be able to respond to that. And so the two inverted pyramids that you see on this slide reflect that principle. Asma already spoke about data and the estimates of the number of children that are in the world that have additional needs. Unfortunately, we know from the evidence that many children are not recognized in time, and even when they are recognized, that services are not always available to then meet their needs. So the Nurturing Care Framework provides a broad outline for responding to this agenda and calls for strengthening policies and systems so that they are ready to support children with developmental difficulties and disabilities, as well as their families. And the principles therein that it promotes are oriented around prevention, early identification, putting the family in the center of that care, having a focus on functional abilities, building caregiver capacities to care for the needs of their child, the importance of transdisciplinary services, and the overarching theme of inclusiveness and participation. So we are excited that today we have this webinar where we will hear about practical examples of how such systems are built from the bottom up using a twin track approach and really using the platform of primary care for early recognition and early care. Within WHO, in partnership with UNICEF and others, work is in progress to respond further through this agenda, both in terms of building caregiver capacities, as well as a global report that will highlight more issues around disabilities that will be ready for next year. And my colleague Chiara Servilio, who is in the audience, will be glad to speak to that in the discussion. So I would like to close with saying that we are very excited about this opportunity, and we look forward to the presentation and the fruitful discussions that we are going to have. Thank you.
Thank you so much to Asma and to Bernadette for this excellent framing, and to Sohi for the wonderful welcome. Now we're going to jump into really the meat of the webinar today. We have today 3 country examples. One from Svetlana Drivdal from PATH. She's going to talk a little bit about the experience in Mozambique. We also have Zarina Korbun-Bekova from Aga Khan Foundation, Tajikistan. She's going to talk about actually how parents and parent organizations in Tajikistan, through a bottom-up process, were able to influence the national level and the government to really think about children with disabilities and developmental delays. And we also have Maria Elena Ugaz from UNICEF Peru, who will be talking about their use of care for child development which is one of the many types of different packages to support parents and caregivers and their experience with that. But before we get to those wonderful country examples, we're going to start with Dr. Amina Abu Bakr at the Aga Khan University's Institute for Human Development. During this COVID period, there's been many opportunities, not only for programming, but also for research. So Amina is going to present to you the initial findings of research that they're leading, which is has been supported by the LEGO Foundation, and it's looking at COVID-19, and it's looking at COVID-19 and includes children with disabilities. I would ask for all people, while, as these presentations are ongoing, feel free to use the Q&A tab to ask questions. We have colleagues who will be compiling questions, so when the presentations are done, we can go ahead and ask panelists questions. So feel free to, in the Q&A tab, to ask your question as the presentations are happening, because we'll just do Q&A at the end of the presentations. So with that, I'd like to welcome Amina to share some of her experience. Thank you.
Hi, good morning, good afternoon, depending on where you are. Many thanks, Sweta, for this opportunity to present. I'm really going to present very, very early on results on looking at, the impact of COVID in the context of childhood disability in urban informal settlements. Just to put it in context, so IHD has been working in urban informal settlements, developing integrated parenting programs for the last 3 years. And therefore we thought that, going out to understand how COVID is impacting on the lives of the children there would be so important in terms of the way we move forward with our interventions. But we actually made a very strategic decision to ensure that we sample purposefully families of children with disability, because many a times they're just included in studies and in surveys, or actually sometimes excluded because people don't pay specific attention to it. So I'm going to present a very small part of our work, and I hope it can lead us to more discussion. So needless to say, that COVID-19 pandemic has presented us with some unprecedented challenges globally, but we feel that in the urban informal settlements, these challenges are especially magnified. And I'm going to take a few minutes just to focus on why urban informal settlements is really a focus at IHD. One of the key reasons is that Africa is, urbanizing really, really quickly, and very many people living within the urban informal settlement, within the urban centers. So by 2050, we expect 50% of that population to be of Africans' population to be in urban centers. And we find that the problem is that the infrastructure is not catching up as quickly. So there are so many economic, social, health challenges within these urban informal settlements. And quite a number of the people living in these settlements are children. So for instance, in Nairobi, it's estimated there are 2 million people in urban informal settlements, and 50% of them would be children. So we are looking at around 1 million children living in these kinds of settings that would impact negatively on their developmental outcomes. So during the early days of the COVID pandemic, our government put in quite a number of mitigation measures, which meant that we couldn't continue with our work, but we were so curious to do a rapid survey and situational analysis where we would understand what's happening in the first 5 years of children, in the lives of children who are less than 5 years, and what does that imply in terms of programming, So this rapid survey, its general objective was to characterize the impact of COVID-19 mitigation measures on various aspects of mental health, parenting behavior, health-seeking behavior, health utilization for pregnant women, but also for caregivers of children under 5. We had a special, a specific focus for children with disability, and today's presentation will focus on this. We were able to work in 3 urban informal settlements, Kawangware, Mathare, and in Mombasa, a place called Bangladesh. We were able to survey 1,010 participants, of which 165 were caregivers of children with disability. And we used a sequential mixed method approach, where we first did quantitative surveys through telephone interviews, and then we carried out interviews with caregivers and key informants. In selecting what we will look at, we really took into consideration the nurturing care framework. So we looked at aspects around access to nutrition, to health services, to protection, early learning opportunities. So due to time pressures, I will share a very small bit of the results, and actually the data is still being analyzed. So we hope to be able to disseminate it some more. So some of the preliminary findings. So if you look at just from an economic point of view, both for families of children without disability and those with disability, they considered the COVID-19 mitigation measures to be a very serious threat to their economic livelihood. So in that case, we didn't find much differences, but just the fact that for all families of children with less than 5, this was really considered a major threat. And we find that similarly, education was really disrupted across both groups, those with and those without disability. What was interesting, and I've not put up on this slide, is that while the government really was focusing on online learning and continued education through basic access to classes virtually, in this setting, only 8% of families could access this. So from an education point of view, I think one of the key things that come up is that the COVID-19 mitigation measures actually would increase the inequalities. So for families from high socioeconomic status, their children continued with some virtual learning, but in these settings, most of this stopped. The other things we looked at is in terms of childcare and the time they spent with their children. So actually in that way, most parents and caregivers reported that they spend a lot more time with their children during this time because of lockdown. What we need to analyze a little bit more, and will come out in other reports, is paternal involvement. And we find that many of the children either stayed with a primary caregiver or an adult. So we can say that few of them really experienced any threat from not having an adult supervise them during the day. We also found that engagement in some of the activities, such as reading for children, was really similar, both for children with disability and those without disability. What is interesting, other than singing, where we see almost 81% involvement from the adults, and taking the children outside the house, I think there's still a lot more we can do in terms of narrating stories and engaging children in other things that could stimulate their cognitive development while they're at home. The other thing that was of interest to us is if they've experienced any disruption in their access to healthcare, and we saw that up to 60%, slightly more than 60% of the participants said they could not access normal therapy and normal medication needed for things such as seizure control and occupational therapy, which is quite alarming, considering that these kinds of services are so important for the well-being of the children. And some of the causes, the key cause actually was economic. I think, if you look at how they were unable to offer service, it's really because they could not access funds needed. Although in some cases also very important is that facilities were closed or care providers were not available, or in some cases, they couldn't afford very basic PPEs and therefore were afraid of going to healthcare centers lest they get infected. So I think this came out as a very major concern, access to healthcare services in terms of disruption. Another area we looked at is mental health. And in general, well, the really there was a concern of mental health in terms of depressive symptoms. I don't use depression because this was not clinical assessment, but that came out a lot. And I think it's partially related to the fact that the caregivers had to deal with the worries and anxieties around COVID, but also the economic impact that comes with it. We also looked at really COVID-related anxiety, and we found that when it comes to COVID-related anxiety, in families of children with disability, this was really so much higher considered to the general population. And I think part of it was the practicality of implementing COVID-related measures. So you can imagine for parents of children with maybe ASD, would the child be able to wear a mask over the long period, and things like that really made them anxious. So in general, I would say these are really preliminary conclusion because we finished data collection like 4 weeks ago. Our study indicates that the impact of COVID mitigations for children with disability is very similar in many ways to those without disability, although this might just be an indication that really we worked in a community where most children in any case are experiencing a lot of disadvantage. The two key areas that have come up that we really need to pay special attention to is access to health services and therapy, but also caregiver mental health. But further analysis will look at this data and try to compare it with pre-COVID data we had collected. But more important, we have qualitative data, and we hope we can bring in the caregivers' voices to really tell their story. Thank you very much.
Sweta, you're on mute.
Thank you so much, Shikufe. Thank you, Amina, for the excellent presentation. And I think laying out particularly the situation in Kenya right now with COVID and children with disabilities. But I think it's you'll probably, when you're reflecting on some of these conclusions and the points that Amina made, you may think that actually this is could be relevant to your country as well. So I think with that, I'd like to now start delving into programming. So we know that there's a real problem of access to quality services for children with disabilities and developmental delays. Now let's go to Svetlana Drivdal, who'll talk about the experience of PATH in Mozambique. And I would say also that as the questions are coming in, I see them coming in, please feel free to vote on them. We know that we're going to have lots of questions, but that will help us to prioritize the ones that majority of people are interested in. Thank you. So Svetlana, all yours.
Thank you very much. Can you hear me? Okay, great. Thank you. So I just wanted to preface the presentation saying that I'm not a disability specialist, and the organization for which I work, PATH, is a newcomer to the disability world. We've been working for quite a long time, I would say 8 years, on ECD, on child development, monitoring and promotion, stimulation, responsive care, and early learning. So we are still new. So if you hear some wrong use of terms, please correct us and please be patient with us because we are still learning. Thank you very much. So I would like to start by sharing some data that we have from Mozambique. I hope everybody knows where Mozambique is. It's a big country. It's about 30 million people along the Indian Ocean, eastern coast. And if you look at the data, you will see very contrasting results depending on which data sources you use to look at childhood disability. Our most recent census talks about less than 1% of children under 5 having some sort of disability, physical, mental, visual, or auditory. However, if you look at some other data, such as global burden of disease, the number is closer to 10. And I saw that Francis, in one of the comments, mentioned that globally about 8% of children 0 to 5 in low and middle income countries usually have a disability. So that at least tells me or us that our local or national data is disability is grossly underreported in our national sources, and it might be the same for many other countries, I suspect. so far, what we have seen mostly from our own work from routine data collection is that most disability causes are really preventable. And that tells us that really prevention should be as important as response, as identification and response, because at least in Mozambique, if you look at the data, most common causes are lack of care and nutrition during pregnancy, difficult birth and delivery, postnatal complications, malnutrition, epilepsy, and malaria. Many of those are preventable, as we know. So just as we talk about disability, let's also think about what we can do always to prevent it. So what's done to identify? Because before we can talk about response, we should see what can be done to identify delays in disabilities. In Mozambique, Child Health Card lists basic milestones that each child should be checked against. But however, that part is usually forgotten. We have to really show to the providers that, look, there is this component and this is part of your service is at the community or facility level. So what we've been trying to do is to work very actively with our government in the last few years to integrate developmental monitoring as a part of routine well baby and sick child consultations. So this has been successful and it's now part of the government registers in those consultations. And the same work is currently undergoing for the community health workers at the national level. So we are hoping that this will allow identification to happen both at community and at the health facility. It's still very early on. The registers have been in use only for 1 year. And so far the data, the detection is still limited. So more support is needed. In terms of the tools, we've supported our Ministry of Health to develop very simple monitoring tools. As you can see, look at them here. The one on the left is for health facilities, and it has more milestones and more ages at which to check for milestones. And the one on the right is for community health workers. We've learned that they need fewer milestones and simpler tools to be able to monitor for development. Each tool, of course, is accompanied by registers, by provider orientation, and by supervision guides. So when we work supporting the ministry on early identification, we make sure that it's all the tools that the government needs integrate some aspect of monitoring for child development. However, what we also felt the need for is really a community tool for identification of disabilities. And we've tried to put together such a tool for our community partners. Those are the usually community-based associations working with children with disabilities who go a bit beyond what community health worker would do. You know, they're usually the ones who provide community-based rehabilitation. So we use the 10 questions tool and the working group tool and try to pull together some questions that are most salient and, you know, really easy to apply, and would help activists, community-based volunteers to identify children, identify one of disability or delays they have, and based on that, know where to refer the children and how to support them at home. This tool is still under piloting, and just today I had a discussion with our UNICEF colleague, and we see that some questions still need to be tweaked. So it's a very early stages, work in very early stages. As you refer children, either from community or facility, you have to see what's happening after they're referred. And this is what we are trying to do now in one of the pilot districts, is to really look at the case studies of children who were referred and what happened to them. And unfortunately, the situation is not very good. You see that, you know, out of maybe 100 kids referred, maybe only 20% are actually continuing with treatment, reach treatment and continue with treatment. And some reasons are similar to what other presenters have already mentioned: costs, transportation. Usually facilities are far away. And sometimes it's just lack of follow-up. You know, family couldn't come and then they forgot, and then nobody has followed up on them from the facility. There is also a need for standardized screening tools. So once you have checked, once you have monitored and you have a suspicion of delays, you do want a medical doctor or at least a medical practitioner to screen the child further and to confirm the suspected delays and to identify specific domains where intervention is needed. Unfortunately, we don't have such a tool yet in Mozambique. We know there are quite a few at global level. So I think that's the next challenge for us, to try to help our Ministry of Health to identify, adapt as necessary, pilot and use such a tool in Mozambique for screening. So what's being done to respond to developmental delays and disabilities? So currently I would say we are lucky because we have over 100 districts, and each district has physiotherapy and mental health services. However, as I said, only about 1 of 5 children access and remain in treatment. So services are there, but they're still not enough. The coverage is not enough. There are community-based organizations of people with disabilities who often provide community-based rehabilitation. However, the coverage is very minimal. You know, some districts are lucky to have them, others don't have anybody. And recently, preschool programs have added children with disabilities as a priority group. However, our coverage of preschool programs, again, is very low. It's less than 5% in the country. So again, it's not a very promising strategy for coverage so far. So what we have as PAS have been doing is trying to dig into some of these issues through a small pilot in one district, which is in northern Mozambique, with a community-based organization, where we trained a group of community volunteers to provide developmental nutritional monitoring and referrals, to help counsel families on hygiene, nutrition, basically around the domains of nurturing care, and to link them with specialists and also support with subsidies to reach health facilities. So as a part of that pilot, we've tried to help them to improve the tools that they've already had, to have something called individual child record, pictorial counseling cards, even use resources beyond cards such as radio materials and mentoring tools. So this is just an example of counseling cards. As you can see, they're very simple, very pictorial. You know, that's from the experience of working with low literacy community volunteers. The more pictorial, the better. And so trying to focus on each domain of learning through pictures. Sorry, they're in Portuguese. Yeah, so just as we described, we're really trying to strengthen the capacity of the organization, community-based organization, but also of the practitioners, of the specialists, and make sure there are referrals both ways, because before we started working with organizations, they were kind of working in I would say in silos, you know, volunteers would not refer, they would do community-based rehabilitation, but would not necessarily link families to facilities, which is often needed because there are many underlying causes such as malnutrition or others that have to be addressed together with delays. And so here just a few pictures. You can see on the left a physiotherapist during a home visit, and there is a community volunteer who is observing what he's doing so that after physiotherapist leaves, she's able to continue supporting the family. And on the right, you can see physical rehabilitation activity that the mother is doing with her baby as a part of the outreach. Nutritional screening always as a part of services, and counseling using very, very simple pictorial tools. COVID has changed everything. We had to bring in additional components, such as helping each family to have washing stations, having basic supplies such as soap and masks, and of course, give some kind of support in terms of how to help children during COVID. You know, making sure that the continuous treatment, continuous play and stimulation. So we developed a simple tool which is currently used for that. So next steps, next plans, we hope to continue working with our pilot and really use it to craft some additional, the tools we already have and some additional ones, and then feed it into the ministry work on community-based rehabilitation. And at the national level, we do want to help our ministry identify what's the best platform, because really, how can you ensure coverage of the whole country? You know, are you going to use community health workers? Are you going to use social workers? Are you going to use community-based organizations, people with disabilities? It's really important to identify the platform so they can really strengthen it as a system, as opposed to just having projects in different districts and provinces. And of course, we want to evaluate the pilots that we have to see, especially from the caregiver's perspective, has it been helpful, what they have learned, any improvements in their children, and what should we do to strengthen the community-based rehabilitation. So I think that's it. Thanks very much.
Sweta, you're on mute.
Sorry about that. Thank you so much, Svetlana. That was really great to hear about the experience in Mozambique. Now we're going to go to Tajikistan and hear from Zarina Kurbunbekova from Aga Khan Foundation, Tajikistan. Zarina?
Thank you, Sweta. Hello, everyone. I'll try to share my screen. Can you see my screen?
Yep.
Oh, that's great.
Yep, go for it.
First of all, I would like to thank you for such a great opportunity and thank you for all organizers of this webinar to raise the issue of the disability of children with disabilities. And it is a great opportunity for us to share the experience of Tajikistan, how this process was started, share with the voice of parents. I myself is a mother of the child with the Down syndrome, so I have a little bit experience in the field of disability. Just a minute, please. I would like to share the screen. A minute. Sweta, I think maybe you could. Oh, that's okay.
Yeah.
Will do it.
Go over
Okay.
to slideshow and try that.
Yes.
There you go.
So I would like to, in here in my slide, I just would like to share that everything is starting from partnership. So the one, and in this slide, you can see that actually the initiative of supporting the families who have children with developmental delays and disabilities have been started from the OSI organization, Open Society Institute organization in Tajikistan. And actually the impact of the international organizations to help the parents movement here in Tajikistan is very huge. And within my presentation, I will talk about this more. So I would like to say that since 2003, the first initiative, which was supported by the Open Society Institute, so it was like the supported the first Center for Parents of Children with Disability was created. And since that time, the parents, when they came up together and just started like their initiative to become like initiative group of parents of children with disabilities to talk about their problems, to see how we can change the life of our children for better, to give them an opportunity to be an equal part of our community within the Tajikistan. And since that time, of course, by the support of different international organizations such as the UNICEF and USAID, which we have been saw in my first slide, in 2007, our initiative group of parents became like the Association of Children with Disabilities. So the voice of the parents became more stronger. In 2011, our initiative group also was involved in development of National Concept for Development of Inclusive Education for Children with Disabilities, and by this, which was approved by the government of Tajikistan. And since that time, the activities and the services within this field increased much more. In 2012, our association, the first was in 2007, and in 2012 we became like the National Coalition of Parents Organization of People with Disabilities, and this National Coalition increased for the 40 parents organizations who are becoming the advocates of the rights of their children within the different fields. So to giving the access to the education, to the health and social protections, in 2019, we just recently, I would like to say that we just created like the national network of early inclusion and early childhood intervention network, Tajikistan network, which is advocating the rights of children from 0 to 6 for the necessary care and services. As we have been talking about the nurturing care framework and about the ECD services within the country, I would like to share the experience of our parents' organizations and with the movement which we are doing here. The Tajikistan National Network increased. There are 38 parents' organizations who are the member of this national network, and it is worth to mention that mainly this national network consists of parents' organizations, but also we have the professional organizations who are a part of our network, and the mission of our network is just to promote the every child rights to the life and to be developed within their community, within their family, in their natural environment, starting from the early development. And also we are trying to raise an awareness and build the capacity of specialists and professionals on based on the evidence-based early intervention programs within the country. The activities which is in our national network is providing and going to doing. It is I have to say that we have been working in the different ways. First of all, of course, it is supporting families and of children with developmental delays and disabilities through the different services, provide the home-based care, the early childhood intervention services based on the natural environment. And also together with this, we have been providing different the training, so the capacity building of the local specialists through different trainings and conferences, provide services for families from within our centers, which we have within the countries. And of course, the huge part of our activities is related to the public awareness campaigns, where we are raising the issue of all children, so with the physical disabilities, children who has the mental and intellectual disabilities, and trying to work in this field and change the attitudes of the society towards the children with disabilities. And here we have to say that actually by the support of the government, when the national concept for development of inclusive education was approved, so it gave us, for parents organization, gave the huge opportunity to open the doors of the educational institutions. But there was a case that the lack of services within the early childhood development, within the primary health care settings, just influenced for families to have a chance, or for children to have a chance to receive the necessary education which they have to receive. And together with this, of course, by the support of international communities and starting the discussion with the state institutions, our parents' movements become like the strong one organization who is trying to support the government to develop some documents related to the policy, in the policy level, to make the situation better within the country in order to every family to receive the necessary support. And of course, I would like to mention here that the COVID-19 influenced for the world, and the Tajikistan, of course, in Tajikistan. And all our activities, the parents organization come up together, and we just try to change our activities to support every families, because during the quarantines and the closing period, it was very hard for families to receive necessary support to continuing this support home-based. So that's why our organizations just try to provide service online through the different, using the different technologies, through the Viber, WhatsApp, and Zoom conferences. We are trying to provide individual consultations for the families in order to receive the necessary care and support, and if they have some difficulties, to support them with the psychological also issues. And we are continuing to provide online workshops by the support of international communities, and recently we have been provided our network have been provided trainings on the field of early childhood interventions. So the COVID, of course, it was very hard, but it gave also another opportunity and alternative for our organization to rethink the opportunity of our services to support for families through online issues. The issue of introduction of nurturing care framework, there have been, I would like to say that actually this issue was started in September in 2019 by initiative of the UNICEF organization, when all the international partners come up together and analyze the situation in the field of ECD, what kind of problem the country have, how we can think together, how we can combine our efforts to support the government, to support every parents organizations in developing this program within the country. And in November in 2019, also by the support of the UNICEF and with cooperation of the Ministry of Health and Social Protection, the first Early Childhood Development Forum was organized, conducted, and within this forum, our parents organization and different public organizations by the support of international communities who are developing and piloting a lot of programs and giving the models of the home-based care and the necessary comprehensive support for children with developmental delays, which gave already the they have achieved a lot of good things, and they just presented their activities and showed the results at what kind of achievements they have. And by the result of this ECD forum, by under the Ministry of Health and Social Protection, they was created the working group, which is also was supported by the UNICEF organization, and a lot of activities and work have been done since that time. And I would like to say that yes, the network of parents organization became the huge part of this working group, and they for now we have a good cooperation within the Ministry of Health and Social Protection, and up to date we have been they have been developed the early screening tools, which is and the early childhood intervention standard requirements, which have been approved by the Ministry of Health and Social Protection. So this kind of achievements, which our working groups have already, it gave an opportunity for us as for family within the primary healthcare settings, and also within the education field, to for our families to receive the necessary support for their children, starting from the beginning, from the birth of the children. And also, I would like to say that our national.
Zarina, I'm sorry to interrupt. Can you please wrap up in the next 30 seconds? So, yeah.
Yeah.
Okay, thank you.
Can I continue?
Yes, but yes, absolutely. But can you wrap up in the next 30 seconds so we can get to the next chapter?
Okay.
There'll be time for questions.
So here's
really
some
exciting, but
yes, I understand. Yes, and here our next steps within our early start network, which we are continuing to work on. So the professional development, and you can see in my slides. So the activities, what we are going to do and doing in our daily work. And here I would like to also to show the contribution of the Aga Khan Foundation with the cooperation and with the partnership of the UNICEF and with the cooperation of the Ministry of Health and Social Protection. Within this year, we have been provided and started from the capacity building of the health workers on the early screening, early detection, and the developmental delays and disabilities training. And in the next future, we have been working for expansion of the inclusive and equally quality ECD services for children from 0 to 6 within the geography, which is the Aga Foundation is working, and also together with our international partners, with developmental partners, UNICEF and WHO and World Bank, for the development of the necessary service for children with developmental delays and disabilities within the country. Thank you very much. And if you would be any question, I'm open for that.
Great, thanks so much, Zarina. And it's great to for us to always remember that the power of parents to bring about change. So thanks so much for sharing that experience. Next, we're going to go over to Peru, and we're going to hear from Maria Elena Ugaz from UNICEF Peru, who will share her experience.
Hello, everyone. I'm pleasure to be with you here. Opportunity to share our experience of implementing care for child development for children and disability. Yes, please, thank you. Yes, you hear?
So you can try Maria Elena where it says slideshow on the top,
Okay.
Go up there and then
Yes.
press start slideshow.
Okay, perfect, thank you.
Yep, perfect.
According to 2017 national census, there are more than 31 million inhabitants in Peru, and whom more than 3 million have one or more disabilities. Of this large group of people with disability, 14.6% are children and adolescents. Do you see this? Here I would like to focus your attention on the growth of the children under the age of 3. The table shows that the population is 1.5 million children, of whom 19,000 children have disability. How can promote the development potential of all 1.5 million young children without leaving behind to 19,000 with disability? In the next slide, we'll present the track approach, the track approach. We had used it, seeing tweak track model provided by the project of early intervention for young children and developmental delays and disability. This approach suggests that children with disability need access to universal service and the disability-specific service. In Peru, these services are distributed as following. Universal service include those on which the development of child is acted from a general perspective. Access to this service must be universal, timely, and effective. In this group, we have growth and development monitoring sessions carried out in the health services, preschool in educational services, day care service provided by National CUNAMAS program for children in poverty and extreme poverty conditions. A specific service are those services that address the condition or disability, including those aimed to identify them in a timely manner and empower children and disabilities and their family. In this group, we have early intervention programs or pre-tests, psychological rehabilitation service, and other specialized care service, based in hospital and specialized service. All of these services must coordinate and complement each other so that children with disability or that risk of acquiring them can access them, thus helping them overcome their difficulties, acquire skills, improve their overall abilities, leading the equal rights, opportunity, and social inclusion. CCD development by UNICEF and World Food is effective at reinforcing the capacity of family and caregiver to participate in play and communication activities with their young children with or without disability. CCD promotes sensitive interactions between children and parents and vice versa. It repeats the children's initiative in improved learning opportunity through play using some simple material available at home. it's important to highlight that it's focused on the child potential, not her limitation. The slide showed that adaptation of CCD we did for children with disability and their families. Four modification. One, adaptation of material to Peruvian context, language, and images. Integrate training of ECD and specialized child disability professionals. A model of disability identification and early care was incorporated into training, as well as practical sessions with children with disability. Promotion and coordinate ECD and specialized child disability service. In this timeline, we can see the main steps carried out to reinforce universal specialized ECD service. First, we share information on CCD and did some advocacy with national directors and authorities. It's what's important for them to understand that CCD is not a program, but rather an approach and methodology to reinforce existing programs. Then we trained a core of international professionals at the national level. This is an important topic. And with their participation, we trained trainers in UNICEF for prioritize subnational areas, so a diploma course. This means we had approximately 100 trained professionals. Trainers then trained all your colleagues and professionals from their programs, providing supervision and support, as well as receiving continued monitoring and support from UNICEF. This process achieved change in universal and specific service, as shown in the next two slides. Here can see the improvement in health service, and will highlight two of them. His first is improvement on the arrangement and furniture and objects inside the office to provide more space to play and focus on the children. You see. At second, and you can see in the picture on the left, to the left, the healthcare workers guiding parents with use of CCD, encouraging interact through games and games communication. In the slide, we can see the teacher from early education intervention programs. Before, the activities were led by teachers who demonstrate how to interact with the children, parents, and were observed. After, children interact actively with their parents or primary caregivers. Teachers observe, ask questions, listen, and help solve problems. Now I show you Anita and her mother and video, and hold the video, her mother CCD educational session.
Maria Elena, is there supposed to be volume here?
Okay, okay.
We don't hear,
Excuse.
if there's supposed to be volume, we don't hear it.
Ah, don't hear it?
No.
Excuse me. No, okay, okay.
But we're also running short on
Okay,
time.
the video don't talk, it's only music, excuse me, it's only music,
okay.
no problem.
Okay. Perhaps we can move on
Okay.
since we're low on time.
Okay, okay, no, it's a short time, it's 1 minute.
Okay.
This experience opened a new opportunity to Anita and her mother, but also for the healthcare and educational workers. We are convinced that CCD has made a difference for thousands of children and their family in Peru. However, we still need to have a deeper understanding on the knowledge, aptitudes, and practice of family with young children with disability and service personnel. Thus, we carry out a quality research study in 2019, the first of its kind in Peru. Here can see some findings in these study matters, caregivers, and personal and service personnel, in short, family to receive the support they need from service. And service personnel also willing are not prepared. We have also done bottlenecks analysis of the care pathway for your children, and with this information, we have recognized that some opportunity to improve the detection and early intervention of children with delayed development and disability. Action of these areas will improve detection and intervention, for example, building capacity for personnel for early detection and intervention through better screening, practice, and instruments, increasing resources, equipment, and supplies to aid detection and intervention for some condition. This is the next steps the next year. Thank you. Thank you for attention.
Thank you so much, Maria Elena. So this was great. You know, we got so many interesting examples from 3 different countries in different continents. We also got a little bit of new evidence coming out about this topic, and we had some great framing. So now we're going to open it up to questions. You have all sent in, I believe, your questions. You can keep doing so. I'm going to be looking at some of the key ones that have come out that have gotten the most votes, and then we'll go from there. So all the panelists can open their videos. So the first question I have is from Joyce Ogogo. Is about the impact of COVID. She asks, do you anticipate the numbers of developmental delays to increase with the surge of COVID-19? So I think that can be something that anyone can take on, maybe one or two of you. Who would like to take that on?
I'm happy to reiterate what I typed in a response in that question as well, but I'm happy to reiterate. I think, you know, we know that COVID has resulted in massive disruptions to all sorts of ECD, health, education related services around the world. And so basically what that means is children are not going to be getting the types of supports, the types of opportunities and exposure that are so important for their healthy and optimal development. And so that's definitely likely to have a detrimental effect on children's development. And just to add that the secondary impacts of COVID also brought on by familial stress, economic impacts, et cetera. There are a lot of secondary impacts also that will also likely contribute to child development. Thanks.
Yeah, and I think just bringing back a point that Amina made in her presentation was that actually even the mitigation measures for COVID-19 are actually increasing inequalities. So we would anticipate that, you know, perhaps children with disabilities and developmental delays who were previously not even getting sufficient services might be getting even less services or access to services now. Amina, I don't know if you want to jump in there.
Summarize it well, and I'm a bit reluctant to summarize potential biomedical, exposure to the virus and all that, because we are still, I don't think there's very concrete evidence on that. But we just need to note that with all these social disruptions, there's really potential that there would be more, there would be impact. Like, for instance, there's been an indication that fewer mothers are actually going for the normal MCH, the prenatal care. And we know that, it's recommended someone has at least 3 of them before, to ensure that they monitor pregnancy and deal with any challenges during birth. So if more people are having children at home, less people are going for the necessary checks and treatments during pregnancy, that could also increase potential developmental delays.
Great. So
If
let's
I-
move. Yeah.
But I just wanted to add
Sure.
one more thing.
please.
Just a few days ago, UNICEF released a new report on children with disabilities during COVID, and I'll paste the link in the chat box. But it has some interesting findings that reinforce what we've just been saying.
Excellent. And just for everyone, I know a lot of you are asking for the PowerPoint presentations. ECDAN is actually going to be compiling all of the presentations, and Asma, we could include this report that you're mentioning in that. So it's one email that goes to everyone, and everyone can access all the materials. So let's go to question number 2. It comes from Miriam Chang. She says, at community level, especially in more remote and traditional communities, was there formative research done to assess community perception of disclosing having a child with disabilities? What is being done to promote destigmatization and utilization of services where available? Who would like to take on that question?
So I can maybe start.
Sure.
So we haven't done much yet. As I said, we are really newcomers to the area of disability, but we've done some kind of in-depth interviews with caregivers, not caregivers of people children with disabilities, but caregivers who are just waiting in the consultation rooms to see what the attitudes are. What would happen if the neighbor had a child with disability, right? How would they react? If they had a child with disability, what would happen? How would they treat the child? And based on that information, we actually developed some audiovisual materials such as radio skits, describing a mom who had a child disability and how she was perceived by her neighbors and then what happened with her. So we're just piloting that radio skits now. So I'll be able to have more information later, but I think it's a good way to really try to extract that information from caregivers who don't have a child disability and to see what they think about those children, right? And those families, because very often there are beliefs that the family has done something wrong, or they didn't name the child with the name of the ancestor, or there was some wrong behavior, and that's how the child has gotten a disability. So trying to demystify it through some radio programs, for example, is one way that we are trying to address it.
Okay, would anyone else like to jump in regarding that question?
I can just add to that to say that absolutely is a critical component of the work that, for example, at UNICEF that we do across many countries, working on social and behavioral change through communication for development. And so we work across many different countries where we do things like understanding what the attitudes and stigma are in countries, and then working with local partners, governments, et cetera, to try to change some of those through awareness and awareness also about the rights of children with disabilities. So it's a very critical area of work as well.
Yeah, absolutely. Anyone else before we move on to the next question?
Maybe I also can just share
Sure.
our experience. Yes, the issue related to the attitude towards the families and children with disabilities. We have faced a lot of stigma issues, and the parents are raising this issue that a lot of things was happened even during when they're delivering the babies, and if the child has, for example, Down syndrome or other kinds of disabilities during the pregnancy, the stigma they faced within the health system was very huge. So, and this was maybe the case that we have been started the raising awareness about this, about the rights of our children to receive the equal opportunities, to receive the necessary services, the necessary attitudes, the ethics issues, when the diagnoses have to be saying to the parents how the medical nurses and doctors have to behave in this case, because it is very psychologically, it's very hard for the families when they understand and when they hear the first time that the child which they have been delivered has some difficulties or some development delays or disabilities. And since many years we have been working on this issue, and we still pushing the issue of the ethics, to the attitudes towards the child, towards the families, because we have in the region, we have the cases, a lot of cases, unfortunately, that when the child was delivered in the baby homes, even the adults of the mother-in-law and father-in-law are influenced just to the young family to leave their children in the institutions. So such cases is happening, and that's why our parents organization became like the network, and we're trying within the country raise this awareness through the media, through the social media, discussing this issue through the talk show, the TV sets, etc., to raise the issue of the attitudes, to change the behavior of the specialists, of the professionals. And when we are talking, or when we are explaining and supporting families, first of all, we have to feel and to see to these families and to these children from their eyes, from the eyes of the families. Thank you.
Great, thanks so much. So let's move to the third question. And this comes from Frances Aboud. She says, when is the right time to partner with the government, the Ministry of Health? Is it after you have done some piloting, so you have evidence of effectiveness, or is it right from the beginning when you can only promise a good program, but you have their buy-in? I don't know if Bernadette maybe wants to come in first, just to give like a global perspective and thoughts, and then maybe some other colleagues. Bernadette, yeah.
Sorry, I unmuted myself. If I may, I will start with an answer, and if it's okay for you, my colleague Chiara Savili is in the audience. She's working in WHO specifically on the topic of disabilities. So then I would like to ask her just to complement. So if we look at this question of saying, where do you start? I think we are seeing in the world that there are multiple ways in which countries are being able to put an issue like early childhood development and therefore care for more vulnerable families and children onto the agenda. Sometimes it's born by a high-level commitment, and that high-level commitment at the level of government may come because a particular individual is touched by an issue and says, this is important, we must deal with it, and therefore it's being put there. But maybe more commonly, we see the other example of saying good work is being done that demonstrates that within what the problem is, and then what is feasible within existing systems to catalyze and then to bring those examples to the attention of policymakers and create the commitment around it. I think through the presentations, there was one of the first presentations started deliberately on the issue of partnerships are essential on all sides. And I think we have heard that through the stream of presentations that have been made by Svetlana Zarina and Maria Elena, how sort of there has been always the interface between the technical expertise that may come with organizations vis-a-vis the government and other stakeholders that carry the system. So I would say there's not one answer to this. And for each situation, one needs to capitalize on that. An overarching message is that advocacy at the highest level is important at all times, because we need to bring decision makers along in order to create these systems that are scalable and sustainable. But if it's okay for you, Sveta, maybe a few words of Chiara, who's working with also a host of countries in sort of establishing programs around this. Mm-hmm.
Hi, thanks, Bernadette, and delighted to be able to join this, really, interesting conversation. Yes, I think, the message, is really, that, the interest and the opportunity of initiating some work to really benefit, children with developmental delays and disabilities and their children and their families, may come from, different, maybe different, there are many different opportunities. And in our experience working in low middle income countries, and high income countries as well, across regions, it's really important, at the beginning of the process to really, appraise the situation in its complexity, in terms of, the interacting stakeholders and all the different partners. And and you know, with a key role for, you know, families and advocates, and really try to understand, you know, how to engage all in the process and how to make sure that there is a multi-sectoral type of mechanism in place, you know, to take, you know, the, you know, action forward. Maybe let me, you know, just take this opportunity to say that Bernadette mentioned the global report that WHO and UNICEF are jointly, you know, working at. I invite all of you to contribute, you know, if you think you can, you would like, you know, to suggest any good practice around interventions and actions in this space. You know, please, you know, reach out to, you know, myself, Bernadette, Asma, and you know, we would, you know, be pleased to appraise the suggestions and capture as, you know, relevant to the global report. Thanks.
We cannot hear you, Sweta.
You're muted, Sweta.
Oh my God. Okay, sorry. This has been the issue today. Apologies for that. I should know better. So I'd like to maybe call in Maria Elena from Peru, so we can hear also how Peru perhaps also work with the Ministry of Health and how you convince them and at what stage. And I think Shikufe, you'll be supporting Maria Elena with the translation from Spanish.
Muchas gracias. Sí es muy importante. La decisión tiene que ser a varios niveles. Uno no puede entrar solo a nivel de decisores o a nivel técnico. Tiene que conjugar por lo menos 3 niveles. Continue or?
So Shikufe, I don't know. Okay, I can quickly do a summary. So
Okay.
she's mentioning that you can't just have one level, you have to work at multiple levels.
Yes. Lo que hicimos fue hacer una matriz, un directorio, donde ubicábamos quiénes eran las personas claves en el nivel nacional, de alto nivel político, en el nivel técnico de decisores y en el nivel operativo, ¿no? Y entramos en los 3 niveles.
So she's saying that it's important to find the key people at the national level, but also then at a political level and at a technical level and operational, because all of those levels are going to have different decision-making authority.
Y en los 3 hicimos lo mismo, pero orientado a lo que ellos necesitaban saber. Los decisores, los políticos necesitaban saber que esto era más efectivo. So
she's saying that you know, the general messages will be around the same for the 3 levels, but you know, you're going to have to present it a little bit differently, whether it's a political level or a technical level.
Pero también era muy importante los directores de los programas, que muchas veces no están en procesos formativos porque no tienen tiempo. Entonces teníamos reuniones cortas con los decisores, directores generales, no solamente ministros o viceministros, sino directores generales, que después ya entramos con sus equipos técnicos, que son los que apoyan el trabajo operativo.
So she's saying that you know, the different levels are going to have different levels of time and interest in engaging in this. At the political level, having short meetings is always better, whereas the technical level, you can have more kind of more in-depth conversations.
Thank you.
Okay, gracias, Maria Elena. Great. So let's go to, so she mentioned the multiple levels. So let's go to the next question. The next question comes, I'm not sure where it comes, but it's what recommendations do you have for other country leaders regarding how best to plan and develop national systems for early childhood intervention that will be sustainable and support families and their children with at-risk situations, developmental delays, and disabilities? So this is recommendations for other country leaders regarding how best to plan and develop national systems for early childhood interventions. Who would like to take that on?
Maybe I can share the experience.
Sure, Zarina.
Actually, I would like to say that we have been started the implementation of the early childhood intervention services since 2010, piloting the different within the country, piloting the projects. And maybe it would be like the answer for the previous question also, that to involve the Minister of Health and Social Protection in this issue in the first, it was very difficult. And for us it helped when we showed the results of our activities. When the Ministry of Health and representative of the government saw the experience we have, the services the service we provide for the families, and the results of the services. And when we show the results of the children who are involved in the early childhood intervention program, they are better developed. They are ready for the preschool, to be in preschool and in the school. So it helped us then for the understanding within the like the state organizations. And since 2010, when we have been started this our activities, and we came up together within the country, and we started to work on this issue together, because the voice of organizations become stronger. It's helped us together with the support of the international communities, and the issue of the partnership. Yes, it supported us to prove for the government that this is the best and cost-effective way to implement it, to start this implementation within the government. And then since 2014, when by the support of the WHO organization, when they, with the Ministry of, with the representative of the Ministry of Health and Social Protection, organized the site visiting and saw what is happening around the countries, what kind of the model the parents organization and public organization are doing, and showing the solve the problem and showing the cost effectiveness of this result. The Ministry of Health and Social Protection included this issue to their strategical documents. I mean the strategy of the health and strategy of the education. So after this, it helped us to start the close cooperation with the state organizations and start to work to include it to this, like the it should be like the sustainable and under the responsibility of the Ministry of Health and Social Protection and the Ministry of Education. And currently, within this last year, we had also the memorandum of understanding among the Ministry of Health and Social Protection, and the issue of which I mentioned in my presentation, that we have been starting the early detection, and we have been developed the tools on early screening, which would be included within the primary healthcare settings. So and it is included in the strategical documents of the state, of the health department, and also regarding the education in the Ministry of Education and Sciences. And this has helped us to push it forward and to develop, and we hope that this is for now will become a part of the activities or a part of the responsibility of the state organizations. And the policy changes, when we are talking about the policy changes, it is important to include to the political, to the policy documents. When it would be in the policy documents, it will help us to provide the service. Sometimes we think that we have to have the law, and if we will have the law, everything will work well. But our experience showed that, first of all, we started from our services from the bottom. We started to provide the service, and we then give to the state organizations the evidence that it is working and the cost effectiveness. And this helped us to become a partner of the state institutions. I mean, in my case, in our case, I mean the Ministry of Health and Social Protection. Thank you.
Great. Thank you so much to all of you. Unfortunately, we are out of time, so I want to do just a quick summary of some of the things that we've heard. So we know that children with disabilities and developmental delays are the ones who are often left out or often forgotten. And I think this webinar and the presentation showed that actually we do need to have a special emphasis on them and really, really help them get through this. We heard today a little bit about the critical importance of raising awareness and continuous advocacy, whether it's at a community level, all the way up to a political level, and all the levels in between. And that the conversations that we have may have the general same topics and themes, but they have to be done in a way that is a little bit connects to them and their perspective. I think we also really learned that not only do we need to look at programming, but we also need to think about prevention and how we can prevent children who maybe are starting off with some delays. We can help them get back onto track. We also heard a lot about the critical importance of play and interaction, and when parents and caregivers are able to learn and understand the critical importance that play and positive parenting and responsive caregiving, the critical role of that in really helping children with disabilities and developmental delays. So this, I think, I don't even think that we've finished the discussion. I feel like we've gotten to the tip of the iceberg and dug a little bit into some of these topics. And I hope that in future conversations together as a community, we can also delve deeper into this, learn from each other, share our experiences. ECDAN does have the ECDAN Connect platform, where perhaps we can open up a thread and people can share their thoughts. We will be sharing all the presentations from today and some additional documents to all of you. But let's see if we can continue this conversation as a community and see what we can do so we can help all children, and especially the most vulnerable. So thank you all today for your time. Thanks so much to the panelists for coming and being part of this really excellent conversation. And I wish you all a great rest of your day or excellent evening. Thanks so much. And if the panelists wouldn't mind staying here just for a moment so I can get a photo of you all.
Thank you, everyone.
Thanks, everyone. So could the panelists all put your videos on just so I can take a quick photo? I also want to give a special thanks, sorry, this was an oversight, a special thanks to the LEGO Foundation and to UNICEF for supporting this work and for supporting all of these webinars that are coming out. We really couldn't have done it without all of your support. So thank you for that. And let me see if I can get a photo of all of us, whoever's still here. So just wait one moment. Okay, wonderful. I'm going to take a photo now. Thank you so much, everyone, for joining. And let's see how we can keep this conversation going. Thank you so much.
Can I just
Have a
say
good
before we
evening.
Thank you, everyone.
how I enjoyed
Thank you,
your
everyone. Take care.
It was
Thank you,
wonderful.
everyone.
Thank
Thanks.
you.
Thanks.
Thank
Bye.
you, everyone. Thank you. Thanks, many thanks. Take care.
Take care, everyone.
Bye-bye.
Thank you. Bye.
Bye.